Hello everyone and welcome back to the channel. We have been quite busy bringing on our new PT, Dr. Emerson over at Mountain Man PT, so it's been a while since we posted a video. Onboarding has been going great, allowing us to help twice as many patients each day, but should be slowing down, allowing more time to release additional videos moving forward. Today we're going to explore an injury that plagues millions, Quervain's Tenosynovitis, also known as gamer's thumb. It's a condition that affects the back and the side of the thumb close to the wrist in this region right over here. With this condition, we typically see swelling of the tendons and the lining of the sheaths which hold the tendons in place, leading to pain, stiffness, and decreased function of the thumb. It most commonly occurs from repetitive overextension and abduction of the thumb. It mostly affects two muscles along with their tendons, abductor pollicis longus and extensor pollicis brevis. We can see the two tendons converging right in this region over here. While typically not considered part of the condition, there is a third muscle I frequently see involved called extensor pollicis longus, which you can see right here by extending the thumb. And that's the tendon popping out right there. It's very easy to identify which muscles are involved by asking the simple question, which tendons are symptomatic? The most common causes of the condition are repetitive activities such as typing, texting, video games, and knitting. And while most practitioners target the tendons and the localized symptoms of the condition, these issues are almost always secondary to muscular dysfunction further up the track. Once we recognize and treat not the symptoms, but the underlying cause of the dysfunction, we will see major improvements typically within just a few minutes. And by putting the thumb into a more neutral position during the repetitive activities that cause the injury, there's rarely a need to pause our daily routine or wear any sort of bracing while in rehab. Let's jump right into the method. First, we want to do a quick minute or so warm up to the muscles that we are about to treat and bring some blood flow into the area to help with the healing process and also reduce the discomfort of the treatment itself. So these muscles, they are going to abduct and extend. So doing something as simple as making a fist like this, grabbing the thumb and extending out is usually sufficient enough to warm up both sets of muscles. So I'll do about 30 of those. Once we've warmed up the area, next we want to move over to our pretest. The pretest is pretty much anything that causes symptoms in the area. So for some people it might be as simple as going into that end range extension or abduction where we start to feel a pain. For others, it could be any activity throughout the day where they notice it and it limits their function. Once we figure out what that activity is, we want to perform it. We're going to rate it from 0 to 10 on a pain scale. We're going to remember this number as we're going to use this later on during our retest to actually see if our treatment was effective. Next, we're going to move on to mapping. And mapping is where we identify the main culprits causing the symptoms that limit our function. So for these muscles, they actually go diagonal. We have 3 of them. We have our extensor pollicis brevis, our abductor pollicis longus, and our extensor pollicis longus going just like that. And if we start going into extension right here, we can actually see my extensors moving and you can see the muscle engaging. And this lower third is in general where we're going to find all these trigger points. Same with abduction. So if I go into abduction, we can see the muscle engaging here. So this gives us our general location. Once we know this is where we're going to find the culprits, we have to start searching. And so one way is I can put my thumb there and start engaging the muscles and I can feel them engaging and moving, contracting and releasing. And so then I can take my tool. The goal here is we're not just looking for a tender spot, we're looking for the center of a tender bump. And you may find if it's a chronic injury, the whole area is a little tender, but you will notice that there are these little bumps, and when you get on the peak of them, they're the most tender portion. So to do this, I want to take deep pressure and I'm going to apply it. And I'm just going to look around, and you can actually see me slip off of one right here. See that? So that's my first one right there, and that's in my extensor pollicis longus. So I can take this tool and I mark it right here. Again, I want to get dead center on the most tender portion. Very important here. I'm going to put a little dot. Next I can go and explore a little more. And right there, I already found it. And with trigger points, you can fall off of them pretty easily. So that's why the right angle is real important. But if you watch me fall off of it, you see the little glitch. So there's my second one right there. So I'm going to take the marker and I'm going to put a little dot there. And this is going to make it really easy for me to find the trigger points during the follow-up sessions, make my treatment sessions really efficient where I just go right to the spot. So we're going to check for one more muscle. And this is the abductor pollicis longus. So again, we're going to go in here, putting deep pressure, little tender there, little tender, little tender. Right there. So if I'm here, mildly tender. If I'm here, very tender. And that's the difference a little adjustment can make. And so I'm trying to get where it's the most tender on top of the little bump. Now we're going to move on to actually treating the injury. So I've already got my trigger points mapped, and I already know the general discomfort I'm experiencing during my pre-test activity. So now I'm actually going to treat the area and see if I can make a change. So the tool, all I want to do is I'm going to take this, I'm going to go right over the marking I have. And it's really important because the skin can move around, so I might push on where the marking is and actually not be in the trigger point. And the way to ensure is I get on that dot and I make some micro movements until I get on the peak of the bump. Once I get on the bump, all I'm doing is I'm applying deep pressure. I want to bring my discomfort around a 6 out of 10. And real important, a more advanced technique is if we hold consistent pressure on a trigger point, even within 10 seconds, the discomfort's already decreased as we release some of the muscle cross-bridging. But if I'm holding it and I slowly increase the pressure throughout the 30-second hold, I'm going to release substantially more muscle fibers and the injury is going to heal quite a bit faster. So let's say I get now to 30 seconds there and I'm about a 6 out of 10 the whole time. When I take my pause before I go into my second, third, fourth, maybe even fifth and sixth reps, it's just a 5-second pause. I'm keeping contact to the skin because I'm trying to hit the exact same trigger point again and again and again, each time making it smaller. So here, same thing. I'm on it, make a couple little micro adjustments. While I get it, I'm bringing myself up to about a 6 out of 10, and I'm using a little more pressure this time to get the same effect. And while I'm holding, I'm going to make tiny little micro adjustments just to ensure I always want to keep that 6 out of 10. If you're real sensitive, it could be a 4 out of 10, but the key is not to let it drop below our starting point. So let's say I did 4 reps there. I want a minimum threshold of about 2 minutes of actual pressure treatment time to each trigger point, a minimum of 3 days a week. And every session there should be a very noticeable improvement if you're on the right areas that are correlating with your symptoms. If I choose to do, say, 8 reps to the same spot, and I don't mind, I get a little sore and I'm okay with that, no problem, I'm going to release it a lot quicker. It is my preferred way of treating. Everybody likes to get over injuries quicker, and when I personally get injured, I want it gone as quickly as possible so I can get back into my normal routine. So if I go to my next trigger point, again, same process. So this gets really easy when you start working in different areas of the body because releasing a trigger point, no matter where it is in the body, it's the same process. So I'm going to get right over it. I can say pretty tender even though I'm on the dot. But that micro adjustment, now we're very tender. So I'm holding pressure, getting about 6 out of 10. And again, if I keep my pressure consistent, I'm already at about a 5 out of 10. And that's why I'm going to just put a little extra pressure, stay at that 6 out of 10 for the whole 30 seconds. Good, and then I have my 5-second pause. And this is pretty much just letting the nerve fire. And say we're holding deep pressure for 5 minutes, it's possible I put the nerve temporarily to sleep and I get a little numbness. But if we just give a 5-second pause at least every minute, I've never experienced that happening. It's very safe. but incorporate that 5-second pause always. So we go into our next rep. Same thing, little micro adjustments, getting on the peak of it. Oop, I slid right off of it, so I adjust my angle, and there we go, back on it. It's right there. Okay. Good, so I treat all 3 of these. Now, if I said, you know what, this is the only area where I have pain, I probably don't need to treat these. I can if I want to give myself a little tune-up, because releasing these can actually get my thumb where it's feeling quite a bit stronger and a little faster, as we're able to engage more muscle fibers. But if I just have pain here and I want to get rid of it quickly, I'm going to go right to my extensor pollicis, longest muscle. I'm not even going to bother with these, because this is the one causing the pain in this tendon. These muscles are not involved with that. So I would just treat that trigger point, and then we can move now on to our retest. In the retest, we're going to take the activity where we felt the discomfort during our pre-test, and we're going to perform the exact same thing, the exact same way. So if it was something as simple as extending the thumb, that's all I've got to do, going to end range, which means all the way through as far as I can. It could be grabbing an object. Whatever it was, we're going to take that activity and we're going to perform it. We want to rate our discomfort from 0 to 10 again. If we were successful in targeting the trigger points that are causing the pain further down the track, there will be an immediate reduction in pain. If this is the case, excellent. Now we know which muscles are causing what, and all we got to do is treat this consistently. So again, my recommendation is that we're going to do at least 3 days a week, at least a minimum of 2 minutes pressure time per trigger point, preferably a little bit more, and we can get this to go away usually within a week and a half to 2 weeks completely, back to normal. Lastly, we want to address what caused the injury in the first place. In most cases, it's overextending or abducting the thumb. So by keeping the thumb in a more neutral position, we remove the repetitive stress and trauma that typically causes the injury. If it's from typing or texting, we want to keep the thumbs closer like this. So if I'm typing my thumbs up like this, especially on a phone, this is what tends to really irritate the lining of the sheath and the actual tendon itself. So I want to keep my thumbs closer to the actual surface that I'm pushing on. Same with typing, I don't want my thumbs up like this. So if we think this is neutral, this is stressing the muscles and the tendons, same with this. So we want to be in as neutral of a position as possible, and that will greatly reduce the risk of this coming back in the future. We are at that time, and I would like to thank you for tuning in. As always, if you have a friend or family member who you feel could benefit from a different perspective, please share a link and invite them to subscribe. Please also click the bell so you receive notifications every time we upload new content. And if you feel inclined, please like and leave a comment, as it helps promote the videos higher up in the search results when people look for help rehabbing their injuries. I look forward to continuing this journey with you. Until next time, take care.